Did you know that the average primary care visit in the United States only lasts about 18 minutes? That's 18 minutes to adjust medications, document everything, address your new symptoms, discuss prevention, navigate insurance requirements. It isn't enough time, but it's the system that we have, and complaining about it is not going to get your knee looked at. So the real question becomes, how do we extract maximum value from a pretty severely constrained system? One of the big differences between a productive visit and a wasted one often comes down to a few small things that most patients are never taught. And that's what we're going to walk through today. I also want to mention that I'm including a link in this video down below to a completely free downloadable template that helps you fully prepare for pretty much any doctor's visit. Like I said, it's completely free to download. It takes about 5 minutes to fill out, and it should help walk through most of these things we're going to discuss in the video today. First, understand what's actually happening inside of that exam room. Your doctor isn't rushing you because they don't care. They're navigating overbooked systems, navigating insurance requirements, documentation, and maybe 20 to sometimes 30 other patients that day. Most physicians didn't go to medical school because they were excited about moving patients through a revolving door just to get them in and get them out. But modern healthcare is a severely constrained system. And once you understand the constraints of that system, it can allow you to more effectively navigate within it. Prepared visits can become strategic, while unprepared visits can often become reactive and less productive. Research consistently demonstrates that prepared patients often communicate more effectively with their doctor and get more value out of their appointments. And most people often underestimate how much leverage that preparation can create. Step 2 is the 3 priority rule. Before your appointment, get out a piece of paper or open your notes app in your phone and write down the top 3 things that you would like addressed at your appointment. Not 4 or 5, but 3. And be specific too, not things like a general checkup. Then, when the doctor comes into the exam room and asks you, hey, how are you doing today? Or hey, what can I help you with? You can actually lead the visit by opening with, hey, I have 3 things that I would like to cover today if that's possible. And you can lead with that. That one opening sentence does a lot more work than people realize. It creates an agenda, it signals to your physician that you are prepared and organized, and it lets your doctor triage with you. So this is actually called collaborative agenda setting. And there's research that actually demonstrates that collaborative agenda setting can reduce last-minute concerns, improve patient satisfaction and well-being, reduce physician burnout, and actually have some positive impacts on pain and anxiety somehow. In medicine, there's something called the doorknob complaint. And it's when the visit is winding down, we feel like we've addressed everything we need to, and the physician is reaching for the doorknob. And as we're reaching for the doorknob, the patient will, say something like, oh, there's one more thing I actually forgot to mention. And it's something that happens so frequently that we have this name for it called the doorknob issue. And what happens with doorknob issues is because they're brought up at the last minute, we don't have the proper time to properly address it, but it kind of forces our hand to where, well, now we have to talk about it, or we have to do something, but then we're really going to be rushed and we're not going to be able to fully address it. This can be prevented by utilizing this 3 priority rule. Create that agenda, be organized, be prepared, and go in, and you are much more likely to get your top 3 concerns addressed in that one visit. The third step is to bring data, not just kind of general vibes, if that makes sense. When a patient comes in and says something like, sometimes I feel off, or I'm not feeling too well, this is very general, very vague, and really hard for us to act on. Specific information provided to a physician or healthcare provider is actionable. Instead of coming in and saying, my blood pressure has been high, you could try saying something like, hey, over the past 2 weeks, my home blood pressure readings have been averaging about 142/88. Instead of coming in and saying, I'm tired, I'm fatigued, you can come in and say, I've been only getting about 6 hours of sleep for the last few weeks, and I'm waking up 1 or 2 times on average per night. Coming in prepared with that data, being organized, can allow us to kind of cut to the chase in some situations and save time in those precious minutes in the exam room. Physicians are pattern recognizers, and the more data that you can provide to us to allow us to pick up on those patterns, things like blood pressure logs, sleep diaries, headache journals, records and data like that you bring in and provide aren't overkill. Sometimes they can be the difference between a useful visit and a shrug. We know that in clinics that use pre-visit questionnaires, that reviewing that patient information before the appointment can actually increase the number of concerns that a physician is able to address during that appointment, and also increase the communication and understanding that a patient will get after the appointment as well. The fourth step in making sure that you are optimizing your 15 to 18-minute primary care appointment is to know what kind of visit you're in. Not all appointments are created equally. We have acute care visits, we have chronic disease management visits, we have preventive visits, and knowing the difference between these can often save you a lot of time on the back end as well. An acute visit is there to solve a new problem. In the military, we would define an acute visit as something that's been going on for less than 72 hours, and that would warrant showing up to something like sick call. But the point is, an acute visit is to address a new symptom or concern or illness or injury. Now, compare that to a chronic issue, something like high cholesterol, blood pressure, diabetes. That's a different type of visit, and that may involve more adjusting the medication treatment regimen or ordering some labs and monitoring the effectiveness of the treatment that you've been on for quite some time for this underlying chronic issue. And then you have preventive visits, which are more focused on the long-term risk reduction of developing certain medical conditions. And if you want one of these visit types, sometimes you can specify this in the booking initially, whether you do that over the phone or online, you can specify that. Or when you get to the appointment, you can bring that up initially and say, hey, I would like to focus on my long-term risk reduction and kind of make this a more preventive care visit. That way you're framing the visit from the get-go, and it kind of sets expectations early. Understanding what matters to you most is at the core of patient-centered care. And when your priorities are established early in the visit, it helps us provide more meaningful care to you. The fifth step is to ask more meaningful questions. Consider a question that you might ask, something like, are my labs normal? Now, this is a very broad, general question that's really just a yes or no answer. The physician could say, yes, they're normal, no, they're not, which may prompt further discussion. But the point is, time is limited. You can only ask a few questions. So consider asking a question like, given my age and risk factors, what is the most meaningful change that I can make to reduce my risk of cardiovascular disease over the next 10 years? That question shifts the conversation from reactive to proactive and strategic. Another question you could ask might be something like, hey, what is the number one behavior change that I could make that is going to give me the biggest benefit over the next X number of years? Or a question like, what should I be tracking or monitoring in myself between now and our next follow-up appointment? The quality of care that you receive will often rise to and match the quality of questions that you ask during that visit. Now, the final step of optimizing these very constrained primary care appointments is to make sure that you're closing the loop. Before walking out of that appointment, you should confirm 4 things. What is the plan? What are we monitoring? When am I following up with you? And which symptoms would prompt me to come back sooner, or what we call return precautions? Closing the loop and asking these questions will only take about 60 seconds. And you write these down, and this is on the template that I've provided a download link for. It will prevent you from being up later that night and wondering, what was the plan again? Or what am I supposed to be watching? If you close the loop and close the visit out by confirming those 4 details, it'll just save you a lot of questions on the back end as well. That clarity will help everyone. Now, putting this all together, prepared patients do get better care. And it's not because doctors play favorites. It's because preparation makes the clinical picture clearer, faster. Now, time is a real constraint in these primary care visits, and it's not going away anytime soon. But if the visit is engineered correctly, it can be enough. And the difference between a rushed appointment and a productive one isn't going to be the time, it's going to be the preparation. To be fair, most people were never taught how to prepare for a doctor's appointment. If you want help preparing for your next primary care appointment, I created a 1-page downloadable, free, printable template called the Pre-Visit Protocol that walks through everything that we talked about in this video. Your top 3 priorities, your symptoms, closing the loop and confirming the follow-up plan. It should make your next visit dramatically more productive. And you can download it for free at the link below. The link below is a link to my Substack, which is where I'll be posting articles roughly every 2 weeks or so. But if you go to the bottom of that article, there is a downloadable link for that template for you. All right, guys, that's all I got for you. Thanks for watching, and we'll see you in the next one.